Hi, my name is Julia Prescott, and I'm a second-year Master's of Public Health student at the University of Connecticut. I study within the program of Applied Public Health Sciences, where I'm also doing my graduate assistantship. For my practicum, I intern at Connecticut Children's Injury Prevention Center. This fellowship has helped me grow as a public health student by being able to initiate many of my own projects under guidance of the program directors. This fellowship has helped me grow as a future public health leader by helping me analyze many different public health resources and studies in order to adapt health programming and improve the health of populations. I will use what I learned in this fellowship down the line by understanding how to navigate complex challenges such as getting feedback from different community partners and incorporating that into public health work. Through my work on menstrual equity with the program, I've been able to address the issue of period poverty within the community. Period poverty is the inability for menstruators to access products, education materials, and other resources in relation to their menstrual cycle. With the PAD project, we were able to order many pads to distribute to Hartford Public Schools and Hartford Boys and Girls Clubs. This will help address this issue that is correlated with missing school, lack of ability to focus in class, and also negative effects to mental well-being for students. This was a very informative process for me to build the Political Determinants of Health course under guidance of the program directors. And with this course, I was able to talk to many different professors with a wide variety of expertise in this field. And I believe it's very important for students to learn about the political determinants of health because we understand that there are inequitable health outcomes, but we need to be able to get to the root political and policy drivers of these inequities. For my practicum experience, I worked with Connecticut Children's Injury Prevention Center to adapt a suicide prevention training for the deaf and hard of hearing community. Specifically, we focused on adapting question, persuade, refer, QPR for short, suicide prevention training to make these materials available for deaf and hard of hearing students at the national level through the QPR Institute. So suicide prevention trainings need to be modified for accessibility, specific cultural factors such as specific risk factors, protective factors, and ways of communicating about suicide. So we partnered with the American School for the Deaf in West Hartford, and we have been working with people there to adapt and modify the presentation and resource materials to better suit the needs of the deaf and hard of hearing community. I've been honored to be able to work on many different projects during my time as a Master of Public Health student and as a graduate assistant. So my work with the Political Determinants of Health course helped inform me of the many political challenges to implementing public health solutions and how we can also work around these to make more equitable communities. I've also really enjoyed working with the school systems in Hartford for the menstrual equity work and also at the American School for the Deaf to gain feedback from faculty and students about how we can best adapt programming to improve the health of populations. Going forward in my career, I would love to keep working with student and school populations in order to figure out how we can best deliver public health initiatives where students have to learn and go to school and play every day.